Great. Good afternoon, ladies and gentlemen, and welcome to the probably fastest 15 minutes that you're going to hear. I've got a lot of things to tell you, so if I don't get through all of it, please come down and see us downstairs on the Wi-Fi Spark stand. So, who am I, and what gives me the right to stand up in front of you? Well, I have been in this industry for nearly 2 decades. It feels like a much longer period of time than that, and I'm pleased to say that throughout that space of time of working with healthcare, I've also roped my 2 children into the business, so we are kind of a family business spanning 2 generations, and as a family we have had close personal experience with healthcare. Both my parents suffered with rheumatoid arthritis, cancer and dementia, and I spent an awful long time in hospitals helping care for them. So I am absolutely passionate about what we do as a business and the contribution we make to make a difference to people's lives. For me, the engagement with the NHS started maybe 15, 16 years ago with King's College Hospital, and we put our first Wi-Fi system in on the cancer wards when I didn't really know what cancer was all about. I certainly do now. And the contribution it made and the difference it made to people's lives was just phenomenal. And we've carried on doing that over the previous years. So you may also know that Wi-Fi Spark has acquired a company that we've been locking horns with for the last decade and a bit. We've acquired Hospidia, and we're now in a very unique position of having access to not only some very cool technology that we've developed, but some technology that Hospidia have developed and deployed, albeit with a rather dodgy business model, which we are looking to put right. So, that's me. What are we going to cover? Pretty simple, really. The recognition of the fact that engagement with patients is not exactly where it's at, because hospitals are more than just patients. And we recognise there's a whole ecosystem of people providing very complex care to a very complex and diverse group of patients. The technology that I've just mentioned is a bit of old on the Hospidia side. There's some new technology, and I'm going to discuss how we can bring that together for the benefit of more than just patients. Now, here's a patient who is somewhat famous. I'm not going to read this quote out, but in terms of an individual with highly complex needs, you can just imagine the amount of resource that was required to look after one individual. I've seen the amount of resource required to look after both my parents, and it is staggering. And the ratio of resource to patients is something that not many people outside of the NHS fully appreciate. And when we look at the scale, we're talking about 1.4 million full-time employees across healthcare in the NHS, probably in excess of 2 million with subcontractors and contractors. And they are servicing approximately 900,000 patients per day to some extent or another across the spectrum of healthcare. These are huge numbers. And what are we doing technology-wise about that? That's probably quite a simple question for a very complex answer. But in our terms, where we started out looking after patients, we soon realised that there was a lot more to healthcare and patient engagement than just providing a bit of TV or some internet access. Healthcare organisations are centric around the patient, but the resource that powers it also has some fairly complex needs as well. So we need to be in a position where we can deploy engagement solutions that go far beyond just the patient being able to watch telly or get onto the internet. And when I talk about staff, I'm talking about a very broad church here of users. They do need up-to-date technology and a means to get to the information they require. They need, in their downtime, to be able to be entertained and engaged and reach the services that they need, or indeed that they've paid for. And we are sitting on technology that allows us to do that. So, that technology. The acquisition of Hospidia has given us access to 56,500 bedside terminals. On the Spark side, if you include the Wi-Fi sessions across our estate in healthcare, very high numbers, 750,000 sessions per day, or interactions. When you couple that with patients sat in beds engaging with the bedside terminals, and patients and visitors and staff with their mobile phones, and let's face it, everybody has got a mobile phone, there is a huge opportunity for engagement one way or another to and from those users. So when we consider the patient needs, well, like I mentioned, it's not just about watching TV. Of course, you can watch TV on these devices, but you can also get access to other information, audio books, newspapers, magazines, films, premium entertainment. That's just one aspect of it. There is a big missed opportunity for education. There is an opportunity to take data from other systems and present that over this infrastructure that we know is in every single one of these hospitals. And to give you an idea, we have 130 hospitals that are utilising this technology, and we've got to do a lot more with it. The efficiency gains that can be brought for patients alone by having access to information about their treatment, about what happens to them after they leave hospital, even for their prescriptions, there is an opportunity here to present that information to patients. So they have some fairly important needs. So on the staff side, do we need a separate system? Obviously, every hospital has got a clinical network. Every GP practice has a clinical network. Lots of good stuff to be had there. But you've only got to go downstairs to see that there are application providers who are really keen to get the latest technology into the hands of healthcare. But to do that through the clinical network alone, there is so much governance, so many controls and security policies. It is quite hard to do that. And indeed, there may be another way. So when we consider the staff needs, you'll notice this is very similar to the previous slide. Do staff need to be entertained? Well, of course. We're human beings. We'll need access to the same information that the patients get access to, and that's really important. Education, probably to a different extent from patients, but healthcare is evolving every single day. There is new data, new information, and the means of getting that information out to a broad range of staff is vital. I won't even go there with efficiency. We are all connected. There are so many systems, as we heard in the earlier sessions, so many disparate systems that need to be brought together, and amazing companies that have technology that is starting to do that, that can drill down into these individual systems, mediate across them, and then present that information. So how are you going to get the information in the hands of the healthcare professional? It's a real requirement that we see for staff. So do we make another one? Do we use what we've already got? I think it's pretty obvious. The answer is we have hundreds of millions of pounds worth of infrastructure that Patient Line, through the Patient Power Initiative, and then Hospidia, possibly other providers, have installed in hospitals and in healthcare environments. That infrastructure has all been paid for by somebody else. And right now, it's in a rather awkward business model where we're charging patients access to be able to pay for that infrastructure, and that's got to change. If you add to that, every single person, probably most people, I shouldn't say every single person, has got a device. Could be an iPad, could be a mobile phone. Certainly when my parents were in hospital, one of the first things that I did when I didn't want to pay Hospidia money for using TV is I got my dad an iPad and got him on the Wi-Fi and then started to download content for him to view. But these devices are ubiquitous. So what we need is we need some very cool software to bring that presentation layer to those devices in the most efficient way that we can. Offer that back as a patient service and as a staff service, and we are reusing an asset that has already been invested and is just crying out for greater utilisation. So what does that actually look like? Well, we take our patients and staff, and at the lowest level, we talk about Wi-Fi. Every acute hospital has got Wi-Fi, pretty much every GP surgery, every foundation trust. Wi-Fi is just there. It's mainly used for clinical use, but you can put products on that, like obviously I'm going to plug our Spark Connect, which will light it up and give you all the levels of security you need for public Wi-Fi access. Engagement is television, is content, is media, again, where we have offerings for that. And then communications, there's a whole world of communication applications out there that we need to be offering our patients and staff by using this same infrastructure. So we have a concept of apps It's not a new concept. I kind of stole it from Apple and Google, but people understand the concept of an app. If you go into a healthcare environment and talk about a massively complex mediation solution with different analytics and presentation and hundreds of features, you just turn people off. You've got to keep it really simple to understand what this is actually trying to achieve. So it could be one app is Wi-Fi access. Everyone understands that. Dead simple. Another app is content filtering. Nobody wants to get on bad sites when they're in a healthcare environment. Could be clinical access. The applications are the pluggable architecture that slots into the infrastructure here. For engagement, it could be games, newspapers, content, etc. And then communications, a myriad of providers out there who are able to offer these. And that is important across both the clinical side and the public side. Get your applications fast to market by using this infrastructure. Alternatively, have this infrastructure tunnel into and use and access resources through third-party providers, authenticated by companies like Improvata, so that this is secure and controlled. And open the doors up to third-party providers. There are hundreds of companies developing applications that will benefit healthcare, and we've got a conduit that we can get those applications out to the people that need it. So in summary, the reality of where we are now is you've got some bedside units in your NHS acute hospitals. Keep them. The infrastructure that powers them is super expensive, and I know I've changed my tune a little bit because probably the last healthcare presentation I gave was saying, rip out Hospedia, they're terrible, go for Wi-Fi, it's better. Actually, when you think about it, why rip out something that has cost hundreds of millions of pounds to put in? All those network connections to the bedside, all the PowerPoints, the arms, all health and safety checked, that's a resource we've got to use. So don't throw the baby out with the bathwater. If you haven't got staff or patient Wi-Fi, just get it, because it will really benefit your patients, the visitors, and the staff, and make sure that that network is secure, because it's going to use the Trust's Wi-Fi or the healthcare Wi-Fi, and there are certain gotchas around that. So you then end up with scenarios where you can install new components. On this infrastructure, you could put in iPads, you could buy tablets from Samsung, you can have bedside tables with a screen on them, you can have wall-mounted TVs. There is a plethora of systems out there which will plug into this infrastructure. You can upgrade what you've got or augment the two with a combination of bring your own device and screen-based technology. So when that is there and upgraded, and you've got the right type of component and delivery mechanism to the right discipline within the hospital, you stand a really good chance of getting these applications out to the people that really need to use them. So what does the future look like? We envisage a 3-year time span to get to, if I press the right button, there's an awful PowerPoint build effect, but to get to the right-hand side of this diagram, that's where we all want to be. We want to be able to get to our information using any device in any hospital, to have roaming and information availability across those disciplines. That's where we need to be. And I will put a stake in the ground to say that we are committed to do this, to get this type of solution in place within 3 years. Because the infrastructure is already there. We don't have to reinvent the wheel. We just need to put some very cool software together and deploy it and sort the business model out. For that, we need the help of the healthcare industry. So that's it from me. I do believe the future is bright, and I think we can make a lot of use of what we've got in place. There is going to be a whole series of applications which are developed by companies we might not have even heard of yet. We have to be in a position where we can get those out to the people that need them. So that's the end of my presentation. I don't know how we're doing for time. I have no idea.
Sorry, it's over.
It's over. I do apologise. Thank you very much, folks.
Thank you so much. Thank you so much.